epilepsy and our academics come into place when you're in school? There are a couple different options, and I'm going to do a very, very brief overall level of IEPs and 504s. And the biggest thing to note is we know, and the reason we're talking about this is because epilepsy often occurs in childhood. And so therefore, it's most likely the most common neurological condition that school professionals are going to encounter. And so that's so important because we really need to partner with the school to create a plan and make a profound difference in making sure that our kids with epilepsy on the school campus are set up for success. There's a couple different ways that we can do that. And I'll go over those in just a few minutes on what to look for as a parent and what conversations to have as a parent. So really, studies have shown that epilepsy has some pretty common academic struggles, some things that we're going to notice that may play a part in our children's learning who have epilepsy. So it's just important to note that anytime a patient's having a seizure, depending on which part of the brain, right, the seizure is impacted, our memory and language impairments is a big one. And up to 70% of children and adolescents will struggle with memory impairments, and that's not including any of the medication that might be somehow having some side effects for them or whatever the case may be. That's really because of the seizure. And then our attention. We know that it's a very common academic struggle with attention. We have a lot of comorbidities as far as ADHD and our epilepsy kiddos. So just kind of paying attention to that. We know that epilepsy overall has been found to negatively impact intelligence, processing speed, the attentiveness of the child in the classroom, their ability to perceived organization or making sense of things that you see on a quick basis, and then really self-regulating. They struggle with these different factors while in the classroom setting. On the next slide, I have a really cool little graph that we'll go over. We're not going to go over all of them, but it's here for you to look at a little bit more in depth. But it really goes over what are some of the common things that we see in an academic setting on the different types of learning disabilities, anxiety, depression, things to look for that specifically in studies have shown to affect children and young adults and teenagers with epilepsy. So really, what is an IEP, right? What does that even mean? You hear the word thrown around all the time, and each state offers IEP education and IEP supportive services to children and their families on the school campus. But what really is it? And what do we need to take from this? And what do we do with it? So basically, in a broad spectrum, an IEP is where a child can qualify for special education services. Okay, so a child is going to receive a full individualized evaluation by multiple specialties, and that's really going to determine if a child's going to qualify with one of the 13 disabilities that are listed. And the biggest piece to take away from this is that, does your child need special education services? So even if they have epilepsy, if their intellectual disability, their cognitive functioning, their speech, if there's something that's not being affected through the epilepsy, then they may not necessarily qualify for an IEP. We have a lot of patients who don't qualify for an IEP. They are academically on target alongside their peers. And so really an IEP is for those kiddos who are falling behind cognitively speaking, and needing those extra pull-out services or services in the classroom to help them succeed. The biggest thing with an IEP is that the school is required by law to be reviewed annually. And the purpose really is to set specific, reasonable learning goals that are defined by the services that are going to be set up, the interventions that are going to be set up to make sure your child meets those learning goals through multiple different ways: accommodations, modifications, and support services. The biggest piece I want to make sure that people take away from an IEP is there's a big difference between accommodations and a modification. The biggest thing is that an accommodation changes how the student learns the material, but it does not change the material itself. And that is going to be what's the focus, in a 504. But an IEP, makes modifications, okay? An IEP allows the school and the parent and the teacher and everybody on the IEP team to make modifications and changes to what the student is being taught or what they're expected to learn. So the basic difference is, with a modification, it's going to change the expectation. For example, if a child is trying to learn multiplication problems, the child may just be expected or modified to only do addition problems. So there you're changing the actual academic expectation of what that child is going to be learning for the school year. And an accommodation isn't going to change that, but maybe in the multiplication, in the same situation, maybe in the multiplication, they might provide you with different tools and different things that might help this child learn that same expectation a little bit easier. So that's the difference between the two. So a 504 is very simple in that it's a blueprint, just a quick blueprint, but how the school is going to support a student with a disability and remove the barriers to learning, which is basically making those accommodations, right? You're not changing the learning, you're going to remove the barriers. And when does this fall into place? A lot of times, when a student isn't benefiting from instruction, when they return to school after a serious injury or mental impairment, right? So epilepsy will qualify with that. And then they're not eligible for an IEP. So our suggestion, or I always suggest personally, that if a kiddo does not qualify for an IEP because of, because maybe they're functioning a little bit high, we always suggest that they have a 504 in place. And that's really, really to make sure that if they're missing school days, if they need to catch up with work and they're not going to be penalized, and their grades aren't going to suffer because of that. Maybe we're going to be addressing some medication side effects, kind of like drowsiness or attention concerns. So really, the 504 plan is set up in place if your kiddo is not going to qualify for an IEP, but there's some other things that we're going to be looking at and making sure that they have the appropriate services in place on the school campus so that they meet their academic success as high as they possibly can. So 2 slides from now, I have a list here of examples of accommodations for 504s. A lot of parents will say, well, so my kid doesn't qualify for an IEP, but I don't even know what to ask for. What can be put in place to make sure that my child is going to be successful in the classroom? And really, this is just a brief list of kind of the things that we've noticed that have been helpful for our kiddos, and then all the way up through teenage and high school, is really kind of simplifying instructions, right? Sometimes it's too complicated and they're already having issues with memory impairment and processing. So if you throw a whole slew of information in front of them, it's really hard for them to follow along. Another thing that's going to be helpful is sometimes providing teacher notes. This is mostly for our junior high and high school kids on campus, where sometimes by providing them teacher notes, it really is going to help them prepare when they're studying for a test, because they're going to know, they're not going to be worried in class that maybe they're not paying attention enough or they miss a big chunk of assignments. So that's going to help them when studying, that they have all of the information they're going to need to prepare themselves appropriately. Extended time on tests. Tests for understanding, not necessarily for facts, right? So a lot of times, if you're asking them to put it in a situation where they're explaining in a paragraph, it might be really hard to recall those words the way that they need to in order to implement it on the page. So maybe just questions understanding factual information about what they're expected to learn is a little bit more helpful for them. Modified textbooks, audio recordings, things like that are going to help them be successful in the classroom, versus just saying, well, good luck, catch up, and I'll give you a week to catch up. That's not always helpful. So we just encourage parents to talk to their child's teacher and the 504 team and saying, hey, what can I do? What can we put in place to make sure that my kid's going to have enough support services that's going to help them learn to the best of their ability?